Let's see the adverse effect of tetracycline on bones and teeth and why it is contraindicated in children up to 8 years and also during pregnancy. So tetracycline is contraindicated in pregnancy and also in children up to 8 years. So tetracycline has calcium chelating property and it forms tetracycline calcium orophosphate complex which is deposited in growing bone and teeth. The tetracycline calcium orthophosphate complex is deposited in growing bone and teeth. Use of tetracycline in children and pregnant and during pregnancy causes permanent brownish discoloration of the deciduous teeth due to deposition of chelate in the teeth. It causes permanent brownish discoloration of the teeth, causes permanent brownish discoloration of the deciduous teeth due to deposition of chelate in the teeth. There is increased incidence of caries in such teeth. Tetracyclines also affect the linear growth of bone. The incidence of hepatotoxicity is more in pregnant women. Pregnant women में there is increased incidence of hepatotoxicity. Hence, tetracyclines are contraindicated during pregnancy in the interest of both fetus and mother. It is also contraindicated in children up to 8 years. Tetracyclines have calcium chelating property. The tetracycline calcium orthophosphate complex get deposited in the growing bone and teeth. Use of tetracycline in children during pregnancy causes permanent brownish discoloration of deciduous teeth due to the deposition of the chelate in the teeth. There increased incidence of caries in such teeth. कि ये टीथ का हो गया परमानेंट ब्राउनिश डिस्कलरेशन होगा, caries का इंसिडेंस इंक्रीज हो जाएगा. बोन में it causes it affects the linear growth of bone और pregnant women में it is hepatotoxic. So tetracyclines are contraindicated during pregnancy in the interest of both fetus and mother. Also contraindicated in children up to 8 years of age. Other adverse effect of tetracycline, oral administration पे it causes GI irritation manifested as nausea, vomiting, epigastric pain, abdominal distress, abdominal discomfort and diarrhea. Diarrhea is more common with tetracycline and oxytetracycline as they are incompletely absorbed and cause alteration of normal flora. Risk of diarrhea is low with doxycycline. So this is the advantage of doxycycline, that the risk of diarrhea is low. Phototoxicity. It is particularly seen with dimecyclocin. Phototoxicity is particularly seen with dimeclocycline and doxycycline. They may also produce sunburn like reactions in the skin on exposure to sunlight. They may also produce pigmentation of nails. Hepatotoxicity. Acute hepatic necrosis with fatty changes is common in patients. Acute hepatic necrosis with fatty changes is common in patients receiving high doses. It is more likely to occur in pregnant women. Acute hepatic necrosis and fatty changes. Hepatotoxicity is more common in pregnant women. Renal toxicity. Dimeclocycline may produce nephrogenic diabetes insipidus by blocking the action of ADH on collecting duct. This effect of dimeclocycline has been used therapeutically in patients with syndrome of inappropriate secretion of ADH. Fanconi syndrome. Use of outdated tetracyclines may damage proximal and renal tubules. The patient may present with nausea, vomiting, polyuria, proteinuria, and acidosis. This is known as Fanconi syndrome. Okay, due to the damage of proximal renal tubules by outdated tetracyclines. Suprainfection. It is common with older tetracyclines because of their incomplete absorption. They cause alteration of the gut flora. Superinfection occurs with organisms like Candida, Proteus, Pseudomonas, and Clostridium difficile. Clostridium difficile. Pseudomembranous colitis with Clostridium difficile is a serious complication. Then effects on bone and teeth we already studied. They may cause increased intracranial pressure, pseudotumor cerebri in infants. They also causes pseudotumor cerebri in infants. Okay? They causes increased intracranial pressure in infants. Hypersensitivity reaction, skin rashes, fever, urticaria, exfoliative dermatitis may occur. Cross sensitivity among tetracyclines is common.